Good evening. My name is Jill McAllister, and I am the Corporate Events Manager for Cone Health. We are very happy to be joining First Calvary Baptist tonight to present Your Life Matters, a COVID-19 vaccine education and awareness webinar. Before I hand things over to Pastors Watson and Montgomery, I just wanted to let everyone know who's joining that as you are joining us this evening, all of our attendees are on mute during the presentation. However, after the presentation is over with, we might bring people off mute so we can all have a nice conversation about the vaccine. Or if you have questions as the presentation is going on, please feel free to put them into our chat or our Q&A, and we will get to those after the presentation is over with. And with that, I'm going to hand that over to Pastor Watson.
I was on mute there for a second, but it's thank you, Jill, but it's not Pastor Watson, not yet anyway. Maybe sometime in the future. Thanks everybody for joining us, and we want to really and truly thank Cone Health for doing this webinar for this afternoon. I have the distinct honor of introducing our two guests this afternoon, Dr. Chuck Wallington and also Dr. Alvin Powell. Just some brief information on the two of them. Dr. Wallington is the Executive Vice President and Chief Marketing and Communications Officer for Cone Health. In this role, he is one of the 9 members of Cone Health's senior-most leadership team that sets the business strategy for Cone's $2 billion health care enterprise in the Greensboro, North Carolina area. Chuck was promoted to this role in August of 2019 after serving as Cone Health's Senior Vice President of Marketing and Communications since 2014. Chuck joined Cone Health in 2011 as Vice President of Marketing and Communications. Chuck earned a bachelor's degree in journalism from the University of North Carolina at Chapel Hill. He also earned his master's degree in communications management from Syracuse University. Recently, Chuck earned the Ph.D. in leadership studies from North Carolina A&T State University. Chuck and his wife, Sandra, are active members of St. James Presbyterian Church, where they both serve as elders. Next, we have Dr. Alvin Powell. Dr. Alvin Powell serves as the Chief Medical Officer at Ann Pennington Hospital in Reedsville and Chief Health Equity Officer for Cone Health. Dr. Powell came to Greensboro in 1990 as a nephrologist with Carolina Kidney Associates and has been Medical Director of the Cone Health Hospital Hemodialysis Unit and of the Rockingham Kidney Center. Dr. Powell earned his undergraduate degree at Columbia University, his medical degree from Tufts University School of Medicine, and completed a nephrology fellowship at Emory University. His civic leadership includes work with medical missions in Haiti and Honduras. He is also a big brother with Big Brothers and Big Sisters of the Central Piedmont. At this time, I'd also like to thank Jill McAllister and Mahogany Jackson for their diligent work in getting us set up with this webinar for tonight. And Jill, once again, thank you for all the work that you did to get all this set up. And thank everyone for joining us this afternoon. As the process will be that you will all be muted in the short time frame until the presentation is done, and then we will open that up for questions. At this point in time, I will turn it over to Dr. Wallington and Dr. Powell.
Thank you, Mr. Watson. I appreciate the fact that you have welcomed us, and we are looking forward to having a conversation with you all on this evening. I asked my colleague Jill just before we logged on, remind me how many of these community conversations that we have done as an organization since the vaccine became available. This is now the 16th conversation we have had with community groups, churches, and other folks since the vaccine became available at the end of last year, early part of this year. So pretty proud of that number, and it's all designed to engage you all in a conversation. We want to make sure that as you are considering the vaccine, you have all the facts as we understand them so that you can make a most informed decision about what works best for you and for your loved ones. And we do hope that decision will be for you to take the vaccine as they are available for you in the community. My colleague, Dr. Alvin Powell, will actually carry the bulk of this conversation since he is a medical doctor, very well versed in all of this. But I'd like to start by giving you some context for what we were trying to solve for in having these community conversations. So a couple of things. We had some goals as an organization when the vaccine became available. We were very, very clear that if we were going to be, as our CEO says, cause in the matter, we had to put a stake in the ground and say, out of the vaccines that become available to us on a weekly basis, how are we going to be very deliberate and make sure that we get vaccines in the arms of everybody in our communities who wants one, in particular, our minority and underserved communities. And so we were very deliberate in our approach to making sure that we did that. And so we set a goal of making sure that when we got towards a good sailing point, at least 35% of the vaccines we were giving out on a weekly basis went to our communities, because that represents roughly the minority population in the areas that we serve. And I'm happy to say that we have actually exceeded that goal. As we were talking about the vaccine, it became very clear to us that there's some history that we had to face, because vaccines and other health related efforts haven't always been kind to African Americans. So we needed to acknowledge that. We also realized that it's important to talk to you all about facts as we understand it about the vaccine and vaccine safety. There are also lots of myths out there as well about the vaccine, and we want to make sure that we debunk those myths, and then we want to invite you to help us as we continue to make vaccines available. So those are the topics that we're going to have a conversation with you about today. Jill, next slide. So again, just to go into a little more detail. So first of all, building trust. As I said, if you know anything about the Black and Brown community, you do know that based on history, there's a lack of trust about vaccines and things that are new in the healthcare industry. Dr. Powell will talk about some of those things just to acknowledge and to lay context and provide foundation for the discussion. We also realized, though, that we weren't going to be able to do this work alone. We realized that as a healthcare system, we had to partner with other healthcare systems in the area, which we did very early on. If you remember some of the joint advertising that we did in partnership with Wake Forest and Novant. We also realized in the marketplaces that we serve that we need to make sure that we partnered with our health departments and other folks to get vaccines out in our larger areas. At the same time, we realized that one of our sweet spots was to go into the communities of the people whom we serve. It's one thing to say to our community, vaccines are available at any of the Cone Health locations. It's another to partner with churches and civic organizations and community centers to take the vaccines by way of our mobile clinics into those communities, and we have done that. And we also realized very early on that we were going to need to break down that digital divide that often separates Black and Brown people. If you think about how when the vaccine first came out, the one way that you could register for a vaccine was to go online and do so. Well, guess what? There are lots of people in the Black and Brown community who aren't digitally savvy. They don't have access to this. And so we made sure that we broke through those barriers by finding other ways for people to register for and to get the vaccine. And we'll talk about that a little bit more as well. Next slide. So with that, I will turn it over to my colleague, Dr. Alvin Powell, who has already been introduced. Dr. Powell, the floor is yours.
Thank you, Dr. Wallington, and good afternoon, everyone. It's really my pleasure tonight to speak with you for a few moments about one of the most important public health emergencies of our lifetime. As my colleague, Dr. Wallington stated, I'll speak briefly about the history of African Americans in healthcare systems and the history of distrust, then discuss vaccine safety and effectiveness, and then discuss myths associated with the vaccine. And I'll kick it back to Dr. Wallington to talk more about how one can get the vaccine. So when we think about healthcare in America, there are some fundamental issues related to structural and institutional racism in America that began in 1619. When the first enslaved African was brought to the east coast of this continent. Then, of course, this was followed by the history of Jim Crow segregation and the persistent inequalities that we know continue today. And with this history and this pandemic, we now face a persistent reluctance or hesitancy, or in fact, refusal regarding taking the COVID-19 vaccine. Last year in December, a Kaiser Family Foundation poll revealed that a significant number of African Americans have had concerns about the COVID-19 vaccine because it was new and they feared it was not safe. And these concerns were the same concerns that many other people had. But so what are some of the additional concerns that are relevant and give support to these real concerns from a historical perspective? What are some of the past injustices that create present concerns? Next slide, please. The most famous example, of course, is the Tuskegee experiment. The Tuskegee experiment began in 1932. Many of you all, almost all of you all probably have heard about this. This was at a time when there was no known treatment for syphilis, 1932. The men were not injected with syphilis, as I have actually heard people say. That was not true. That was incorrect. Syphilis was a common illness. And after being recruited by the federal government, in fact, by the promise of free medical care, 600 African-American men in Macon County, Alabama, the town was called Tuskegee, Alabama. These men were enrolled in the project, which aimed to study the natural history of syphilis when it was not treated, untreated syphilis. And despite the fact that penicillin was a cure and available in the late 1940s, early 1950s, the men were denied treatment, and they remained untreatment for 40 years, from 1932 to 1972, until the Associated Press exposed the travesty that took place. During that period of time, some men died from syphilis, wives got infected, and some children were born with complications of this disease. Next slide. J. Marion Sims. J. Marion Sims was considered the father of American gynecology in the late 1800s and 19th century. J. Marion Sims performed experimental surgeries without any anesthesia over and over again. Gynecological surgery on enslaved Black women who had no ability to say no. Next slide. Henrietta Lacks. In 1951, a Johns Hopkins doctor without permission took cancer cells of Henrietta Lacks, a 31-year-old Black woman. And remarkably, those cells continue to replicate, to reproduce, and have been referred to as immortal cells in the laboratory. They continue to be used in scientific research since 1951. They have continued to propagate, and they've been responsible for over 100,000 research papers in major advances in science. And Lack's family became aware of this research in 1975. Billions of dollars as a result of this woman's cells. Next slide. So we know that COVID-19 has really illuminated and shown the light on persistent inequalities in healthcare that exist in our society. And these inequalities that exist in our society have led to an increased number of persons of color to get COVID-19 and have worse outcomes with COVID-19. Pre-existing conditions predispose to these bad outcomes, and historically marginalized populations are less likely to be able to separate or quarantine or work from home, making them more susceptible to becoming infected. So if we focus on the right side of this slide, we see that to date, over 4,245,000 doses, first doses of COVID-19 vaccine have been administered by North Carolina providers. It's pretty significant. That's a lot of vaccine. About 40% of North Carolina residents and residents in the Piedmont Triad are people of color. But when we go to the far left, vaccines by race in North Carolina, we see that only about 18% of African Americans to date have received the COVID-19 vaccine. Almost 70% of white individuals have. And the other racial minorities are in the single digits. Similarly, the Hispanic population, the percentage of individuals who have received the vaccine is about 7%. So there's a significant disparity that exists in folks getting vaccinated, despite the fact that patients of color are more likely to have significant complications from this infection. Next slide, please. So why should you get the vaccine? What's the big deal about this? Let's talk about its efficacy, its effectiveness, and its safety. And let me share for a moment that I got the vaccine day one when it was available. I have 3 adult children who are all in healthcare. They have received the vaccine. My wife is a healthcare worker as well, and she has received the vaccine. I don't like shots, but I knew that this was something very important. if I wanted to say stay safe and if I wanted to keep my family safe. Next slide, please. There you go. Thank you. So why should you get the vaccine? So let's look at the numbers. These numbers are incredible. No one, I believe, could have imagined that we'd have these types of numbers today. 3.7 million deaths, over 3.7 million deaths to date worldwide. 172 million cases worldwide. Almost 600,000 deaths in the United States, which is remarkable. 367 deaths per day now, on average, over a 7-day period. And that's a significant improvement, but people are still dying from COVID-19. Still too many people are dying at 367 deaths per day. And once again, African Americans are almost twice as likely to die and 3 times more likely to be hospitalized compared to white individuals. Think about that. Twice as likely to die, almost 3 times more likely to be hospitalized. Vulnerable population. Next slide, please. So what about this effectiveness of this vaccine? How well does it work? I will tell you from practicing medicine now for almost 40 years, this is a remarkable tool in our toolbox. 95% effective, 94% effective, and 72% effective. The Pfizer, the Moderna, and the Johnson & Johnson products. What does this really mean? This means that if you get the Pfizer or Moderna vaccine, you're 95 and 94%, you have a 94 to 95% chance of not getting COVID. And if you get the Johnson & Johnson, you have a 72% chance of not getting COVID. I would take any of these vaccines because this chance of not getting COVID is great. I have a 5% chance with Pfizer. That means that I might get the sniffles, or I might be asymptomatic. I might have a 6% with Moderna, and maybe even a 30%, 28% with Johnson & Johnson. I'll take that anytime over getting sick and hospitalized. You have about a 99% or greater chance of not dying when you get this vaccine. 99% chance of not dying when you get this vaccine. You have about a 90-something, maybe 98% chance of not being hospitalized. But this is an incredible vaccine. Even the Johnson & Johnson, super effective, and it will keep you safe and it will keep you alive. Next slide. Please, thank you. So how safe is this vaccine? Well, during the clinical trials, 110,000 people participated in these trials with no major safety concerns. At Cone Health, as of today, over 8,000 physicians and healthcare workers have received their first vaccine. 7,635 physicians and healthcare workers are fully vaccinated. I'm one of those. Dr. Wallington is one of those individuals. And I think Ms. McAllister is one of those individuals. 91,806 people have been partially vaccinated, and 88,516 people have been fully vaccinated in our community by Cone Health. And 170 million, over 170 million individuals fully vaccinated in the United States with no significant safety concerns. Very impressive. Next slide, please. So what are some of the side effects? Well, they're minor. And when you think about those of us who've had children and have taken their child to get their vaccinations, their immunizations, these are the same kinds of symptoms that that child might get when that child is cranky and irritable that first night or two after getting their immunization. So the shoulder might hurt. People might have some fatigue or headache, muscle aches, chills, fever, and some various other minor complaints. On a personal perspective, I got my shot. I felt nothing. In fact, I looked at the nurse to verify whether or not she in fact gave me the shot. And I looked at the syringe because I was very concerned. It was painless. About 3 or 4 hours later, my shoulder began to ache, and I felt good because I recognized and realized that I did in fact get the shot. my body was responding to that immunization. And I was really content and felt pleased that my body was responding. I did have some fatigue as well, but those symptoms pretty much lasted about a day. And the second shot, they lasted about 2 days. Next slide, please. So there have been a lot of myths out there about the COVID-19 vaccine, and this has probably created some of the challenges that we face right now. Social media has created a lot of issues around this vaccine that has created some hesitancy, some resistance, and it's become politicized as well. But let's go to some of these myths and talk about them. And as I often tell people, I don't really like to talk too much about these myths because I don't want to spread any, but certainly I think it's important for us to bust these myths. Next slide, please. Myth number one, COVID-19 vaccines cannot be safe because they were developed quickly. Well, vaccines have been around since 1900, and I can tell you that over the years, we're getting smarter, we're getting faster, we're getting better tools. And for this particular condition, we were in the middle of a pandemic, and the federal government spent billions of dollars, and there was no risk financially for any of the vaccine companies. No phase was skipped. Every safety initiative that has always been taken was taken with this vaccine. It's very safe, and it was accelerated, but it was not rushed. Next slide, please. The mRNA method of the Pfizer and Moderna vaccines will alter my DNA. That is false. The mRNA method of Pfizer and Moderna vaccines cannot alter your DNA. It does not affect human DNA or any DNA. It does not contain any infectious elements. It cannot give you COVID-19, so you can't get it because there's no COVID-19 in the vaccine. And absolutely, it will not make you sick from COVID-19. Next slide, please. I already recovered from COVID-19, so I don't need to get vaccinated. Well, the fact of the matter is that if you have had COVID-19, you will develop some immunity from that, but the COVID-19 vaccine immunity is clearly better than the immunity that you get from getting sick. It's easier to predict the response from a vaccine. If you've had COVID-19 vaccine, you should wait 14 days after you were first diagnosed with COVID-19 before you get your vaccine. And if you've received monoclonal antibodies as part of your treatment for COVID-19 vaccine, you should wait 90 days after you were first diagnosed. So you should get vaccinated after you've had COVID-19. Myth number 4, no African-American or Latino participants were involved in the COVID-19 vaccine trials. This is not true either. In fact, there was a lot of intentionality involved with making sure that patients of color were enrolled in these clinical trials. So nearly 1/5 of the volunteers in the 30,000 person Pfizer vaccine US trial were either Black or Latino. And this is a variation from the typical low rate of only 3%. So there was significant representation. Myth number 5, the vaccine trials did not include volunteers with pre-existing conditions common in the Black and Latino community. Once again, because of the representation that was present, there was a good number of individuals that have pre-existing conditions such as heart disease and hypertension or diabetes that's common in African-American and Latino communities. And the vaccines were tested in patients who were taking common medications that are used to treat these pre-existing conditions. And so those situations and concerns were already taken in consideration with these clinical trials. Myth number 6, the vaccine will cause infertility. It will not cause infertility. It will not interfere with pregnancy. It will not interfere with breastfeeding as far as we know. And so it's been considered safe with respect to causing infertility. Myth number 7. This one is, I think, amusing a little bit, but I think people have been very concerned about the fact that the COVID-19 vaccines were developed to control or track the population through microchips. The thought is that people could be injected with chips and that folks could be tracked. And this myth was based upon a comment from Bill and Melinda Gates Foundation regarding a digital certificate of vaccine records. It had nothing to do with the COVID-19 vaccine, just a record-keeping software development process that was confused or conflated with microchips. And with this, I will turn it over to my colleague, Dr. Wallington. I'm sorry.
That's okay. Thank you, Dr. Powell. Before we open it for questions and answers, let me share with you a little bit more about the vaccine, again, in the spirit of making sure that you know as much as we know. So first of all, who can get the vaccine? And so when we started this, again, 15 or 16 conversations ago, the age range was much higher. Now anyone who's 12 years and older can get a vaccine depending upon what's being administered. So for Pfizer, those who are 12 and above are eligible for that. For Moderna, those who are 18 and above are eligible for that. And for the Johnson & Johnson, those who are 18 years and older are eligible for that vaccine. On the next slide, what to expect when you go get a vaccination. This is pretty standard regardless of where you go. First of all, you have to wear a mask and plan to remain socially distanced. There is a wait time of 15 minutes after the vaccination or 30 minutes prior to if you have a reaction. Can you go back for a second, Jill? You will also leave, if you're taking Pfizer or Moderna, you will leave the first appointment with an appointment card so that you will know when to plan to come back for your second vaccine. And please don't lose that card. That card is worth its weight in gold and then some, because it is basically your proof that you have been vaccinated. Next slide. So the CDC says for people who are fully vaccinated, if you're fully vaccinated, you can resume activities that you did prior to the pandemic without wearing a mask or physically distancing. And of course, there are exceptions, as you might imagine. I will say here that it was great to gather with my family around Memorial Day weekend in a very small and controlled setting at our home, and everybody there had been vaccinated. So it was like reliving what life used to be prior to the pandemic and remembering what it was like this time last year. As I'm sure you all remember, we were all hunkered down and weren't doing anything with anybody. So that is certainly a bonus for being vaccinated. Next slide. So if, again, you need to know how to find a clinic, they're all around you, but you can go to the website if you want to, conehealth.com. And again, in the spirit of making it easy for those who may not be digitally savvy, there is a phone number. It's great if you can register, and if not, it's okay. We are certainly accepting walk-ups at our clinics. So with that, let's open it up for questions. And Jill, I'll ask you to take the slides down. Thank you. And I think they're enough to perhaps bring us all over to one side.
Yes, sir. I'm doing that right now. I'm going to go ahead with all of our attendees, and I am putting on here that everybody's allowed to talk to us now if they'd like to come off mute. We do have a question to get us started from Mahogany Jackson. Is it okay to wait longer than the recommended wait time before receiving the second dose?
Dr. Powell?
Of course, we don't want you to wait. We want you to follow the current guidelines and recommendations. If you're talking a week or so, it's probably not a problem. But the recommendation is to get the vaccine on schedule. The problem with waiting is, frankly, that we don't know how effective the vaccines will be. We know how effective they will be on the schedule that is listed for that particular medication, for that particular vaccination or vaccine. When you start changing the time frame, then you are basically doing an experiment. And we like to try to avoid that. Great question.
See. Go ahead, Mr. Watson.
Dr. Powell, I had a couple of questions really, and most of these are kind of myth busters. But the first one was around the whether the vaccines were actually approved by the FDA. I know that they were, but there's that myth out there that it wasn't actually approved by the FDA. They were because of the fast track process. Can we kind of just put that to bed to say that they were definitely approved? It was a fast track process utilized, but they were definitely approved by the FDA through that fast track process.
Right. So that's a good question. And the answer to that is a tad bit complicated in that the vaccine was approved by the Emergency Use Authorization Act, I believe it's called, the EUA. And with that, there were clinical trials that were abbreviated. Because we're in the middle of a pandemic and because all the safety guidelines were met, it was felt that on an emergency basis, this could be released. If we were not in the middle of a pandemic, it would have taken a little bit longer to approve. So it's true that it is an emergency use authorization, but it was authorized and approved by the federal government, but on an emergency basis.
Got it. That does not take away from the fact that it has been approved and ready to use. So
you're absolutely correct. It's approved, and we're in a pandemic, and
right.
This is what was required.
Gotcha.
If we weren't in the middle of a pandemic, it would take a little bit longer.
Absolutely.
Mm-hmm. Is there a part two to that question, or did we get it?
I'm gonna let someone else. I've got a couple other ones, but I'm gonna let the thing go around a little bit here. So.
Okay.
Mr. Cook, I think, was up next.
Okay, it's actually Mrs. Cook, but computer. I have a question. My question is from myth number 3, and it was about if you've already had COVID. And my question is regarding the way that the body works. The body is a great specimen, and it does great things on its own. And if you've had COVID, which I've had COVID, and you have antibodies, how is it that the antibodies that you're getting from the vaccines are better than the ones that your body made naturally? Or are they the same? Are they the same as what you would be getting from the COVID vaccine shot?
Great question. I think the answer to your question is better in the sense that we have a better understanding of your body's response to the vaccine versus your body's response to the infection. So if you take 100 people and you give each one of them the vaccine, they will get the same exact dose. If you take 100 people and they get COVID-19, they'll be all over the place as far as the amount of what we call an inoculum. How much did I cough into your face, COVID-19? How much did you get? And how did your body respond to that? So the inoculum, the dose that person got will be different from person to person to person. When you give a vaccine, it's a finite amount, it's predetermined in amount. And so it's easier to predict how someone's going to respond with immunity. It's less easy to predict that when someone has gotten sick from COVID-19. So a prudent public health policy is to give everyone the same dose of the vaccine, whether they got sick or not, because you might have someone, we already know that people who get COVID-19 can get it again. And we've seen that in the hospital. So people have been infected and they get readmitted three months later. So to prevent that from happening, or 4 months or 5 months later, to prevent that from happening, the vaccine is the recommendation.
But if you get the vaccine, can't you also, your chances are lower of getting COVID, or if you get COVID, you're going to get less sick. Is that correct?
Absolutely, you're going to get less sick. No question about that.
If you had COVID, you probably will get less sick if you get it again, based on the fact that you should have antibodies to it.
What we do know is that people have been hospitalized more than once with COVID. So people are almost never hospitalized once they've received the vaccine. We know that, and they almost never die. once they've received the vaccine. The vaccine is very effective. Getting COVID-19 is not equivalent to, if you look at statistics, to getting the vaccine. You're much more likely to get a recurrent case of COVID-19 if you had COVID than if you had the vaccine, if that makes sense.
So we had another question come in on our Q&A. Should we be concerned with returning to normal activities after being fully vaccinated, given the recent data on breakthrough cases?
I think we should absolutely be concerned about resuming normal activities. We're not ready yet for that. We still need to wear masks when it's appropriate and be safe when we're around people who have not been vaccinated or we're in large crowds indoors. I think that's very important. So we still have work to do. We are still in the middle of a pandemic. And so we should be concerned, absolutely. That's why we're here. That's a great question, very important question. We are not to the point where we are ready to throw in the towel and say it's all good. Those of us who've been vaccinated, we are in a pretty good spot. But we need to continue to be careful because we still have the ability to get COVID and transmit it to someone else. Again, 95% effective is fantastic. If you are one of the 5% to get infected after you've been vaccinated, you could be asymptomatic and transmit it to someone who has not been vaccinated. And so that's one of the concerns that we have.
Yeah, I've started to realize that looks like it's been a process of more individuals not wearing masks in the last few weeks because of what's been happening now. And that's kind of scary within itself because like you said, we do have the ability to still catch COVID even though we've been vaccinated and we can still pass that on. So that is definitely a concern for me. And from what I've seen out in the streets on a daily basis here, there's people just not wearing masks anymore. They just look like they're just getting rid of them.
Right.
Let's see, we have another one here. During the clinical trials, why was the African-American participation only 1/5% or 20%?
Dr. Wallington, do you want to answer that one or do you want me to answer that one?
Go right ahead, sir.
You know, I think it's the same reason why clinical trials have a low percentage of people of color traditionally, historically. One reason is because of historic distrust. And I think that's an important reason. And again, it said, the slides show that on average, 3% of participants in vaccine trials in the past have been people of color. So there was intentionality around getting more people involved, which was a really good thing. And hopefully it has helped people feel better about getting the vaccine. But the same reason we have hesitancy around participating in clinical trials, I think is some of the same reasons that we have hesitancy around participating in getting the vaccine itself. So I think it's a continuum. Great question, but I do think it's a continuum. It's based upon history.
So we had another question come in through the Q&A. What are your thoughts regarding churches reopening their doors for services indoors? Some require masks and some do not.
I think that churches should follow guidelines. And I think there are specific guidelines for churches. The CDC has given some recommendations. I know my church has been open for a while. We wear masks. We are socially distant. They're very careful about wiping off microphones if they're shared and all that. So I don't have a problem personally with that. I think as long as folks follow guidelines and they're careful, I think it's appropriate. But the whole thing is to be reasonable and try not to hug a lot of people and shake hands and all those kinds of things. We still have to be careful. Follow the rules. We know what to do. We've been doing it for a year. Everyone knows what to do. Keep doing do the right thing. The 3 W's.
Mr. Watson, did you have another question you wanted to ask?
Yeah, I did. I think it's a myth, but just to make sure that we get it out there, there's a conversations being had, especially on social media, that individuals are dying from the vaccine. I don't know whether you guys have heard that one or not, but any comments you want to make associated with that?
I'm not aware of a single death from vaccine.
I wasn't either, but that's what I've heard. So.
Right. I'm not aware of a single bona fide, legitimate death from a vaccine. Let me qualify that. Someone told me about something, and of course, it's hard to correlate. Someone got a vaccine, they die. Well, people do die,
Right.
and whether it's cause and effect, but I'm not aware of a single vaccine-related death.
Do you have any- go ahead.
Yeah, I was going to get back to Ms. Cook's question, because I think that was a good question, and I somehow I feel uneasy about whether I gave her an answer that she was comfortable with, and I just wanted to make sure that you're comfortable with the answer. If you had any other questions or you needed some more clarification regarding your question.
Well, I wasn't really comfortable with the answer because I went and had an antibody test just to see if I had antibodies because I had COVID like 6 months ago. And in getting the test, it said that if I had antibodies, it said that the antibodies that my body would produce and that the vaccine would produce would show up like the same thing. The antibodies could be produced from the COVID-19 vaccine or my antibodies. So that's what
Right.
my body is producing. I mean, from just what I would understand, COVID-19 with the vaccine is trying to produce what your body would produce if being exposed to COVID-19. So I didn't understand why then it's better to have a vaccine.
Okay, well, that's a great question. So I'm glad I asked that because, this is an important point for discussion because do you have the result in front of you?
I don't, but I can probably.
You probably did not have a titer. It probably just said you have antibodies. And the problem with the test, I'm a kidney specialist. And so I have one of my patients who was a kidney transplant patient who called me up, and she was concerned that people who have organ transplants, they take anti-rejection medicines and it suppresses the immune system and it prevents the body from mounting a good antibody response. And so someone advised her to get an antibody test. It was positive. And so she wanted to know whether or not that was good enough for her. And my response to her, and I'll say the same thing to you, is that you may have antibodies, but you may have low levels. And the test that's typically done will not detect the amount. And so you can have low levels, which are not very protective, or high levels. The good news about the vaccine is it tends to give you a predictable response with higher levels, as opposed to getting sick. And so that's why it's important for people who've been infected with COVID-19 to go ahead and get the vaccine so they have a reliable and predictable amount of potential antibody response that has been shown to occur in studies, in clinical studies. So I hope that helps. If you had a titer, a measurement of the amount in your blood, take a look at the lab result or ask the doctor and ask them if this is enough, if you have high levels or low levels. It probably will not say you have high or low levels. It will probably just say you have antibodies. Right. The question is, do you have enough? Right. And that's the difference. And that's what the vaccine will help to establish a higher level of antibody response. And that's what really protects you. And that's why people were breaking through when they got COVID and having a second bout of COVID, because their body was not really generating enough for whatever reason of the response with the antibodies.
What are the levels?
I'm sorry?
What are the levels? Are there certain levels? Are there numbers?
Yeah, there will be. It's called titers, T-I-T-E-R-S.
Yeah.
Titers of the antibodies.
Okay.
Have you, can I ask, well, I will just tell you, I won't get personal, but, you know, again, you know, we do recommend, the CDC recommends that people get vaccinated, even if they've had COVID-19. And I would, if you have not, I would recommend that. You'll be a lot healthier, you'll be a lot safer rather.
Thank you.
Yeah, you're welcome.
So we had another question come in through the chat. Does chemotherapy or immunotherapy have a negative effect on the vaccinated person's immune system?
Great question. The answer is yes. You have a less ability to mount a response to the vaccine. So it's really important to get the vaccine if you are immunocompromised, because you will probably get a response, but it probably won't be as great as someone who's not immunocompromised. But it's important to get the vaccine to protect you, because if you're immunocompromised and you get COVID-19, it's not good. You're more likely, it's a comorbidity of being immunocompromised. You're more likely to get really, really sick. And of course, we don't want that.
And I see another hand raised. Let me see here.
Gil, I'm going to plug in. I might have some audio issues. I'm sorry, because I'm down to 6%.
Okay. I have Dr. Catherine Austin. I've got you unmuted now. Did you have another question?
Yeah, I'm the one that asked the question about the immunization or compromisation with immunotherapy and chemotherapy. And thank you for your presentation. It was very well done. The reason why I'm asking is because I have friends who are receiving immunotherapy, and I was wondering if the doctors actually explained that. Is this being explained to the patients?
Can you hear me okay now, Jill?
I can.
Okay, great. I'm sorry, my camera. Oh gosh, can you still hear me?
Yes, we can hear you.
Can't see you. Okay. Immunotherapy, immunosuppressants suppress the immune system, and hopefully people are being told that the vaccine might not be as vigorous. They might not mount as vigorous of a response. It's important. But the important part is that it's important to get the vaccine, and the vaccine will keep people safer than not getting the vaccine. But that response probably will be blunted some, may not be as effective if they are getting if they're getting anti-rejection medicines or immunosuppressant medication.
Okay, thank you.
Mr. Watson, did you have any other questions?
I did have one more. It's really not a question, but in your presentation, you talked about there's 40% of the population of people of color, but there's only 18% of the individuals who've gotten vaccinated so far. Is that trend going up, or is that kind of stable of where it's been all along? What are you seeing in that realm, and how can we help that process?
Right. No, the trend is not going up. I mean, the vaccine, less and less people are getting vaccinated, but we've come a long way. But we still have a ways to go. And I think we are hitting the point right now, and I'm gonna ask you, Dr. Wallington, to jump in and comment as well. I think we're hitting the point now where we're really getting, with access is easier. It's easier to get the vaccine, but I think people have strong opinions about the vaccine now. And I think that's the challenge that we're having at this point. It's great that we're treating teens. I'm excited about that because it's really great for them to be able to go to school and stay safe. But now we're hearing about hospitalizations of young people, right? We got all the older folks, a lot of the older folks, and we have this big reservoir of people who are young, who are spreading the virus, and now some of those folks are actually being placed in the intensive care unit, sick. So I think it's a real challenge right now with education, and we appreciate you all being on the call tonight, and particularly if folks are hesitant.
Indeed. If you'd asked me to predict 6 months ago where we would still have the challenges in getting people to take the vaccine, I would have predicted it would have been our older community members, simply because they remember what happened years ago. But to my surprise, when we removed the digital divide and made the vaccines available, older people of color in particular were like, get me there, you know, let's go. And so I know our church, probably along with many of the churches you're familiar with, you know, put people in cars, got them to vaccine sites, or, you know, we held vaccines at their locations, and people rolled up their sleeves and they got vaccinated. What's been a surprise to me is those who are in that 18 to 35, 45 age range. Again, people of color. As I listen to one or two talk, they're hung up on the whole notion of, if I get the vaccine, I won't be able to father a child, I won't be able to give birth. And as Dr. Powell's pointed out, that couldn't be further from the truth. But in their peer groups, sadly, that's a myth that's going around, and many are latching onto that. I also am going to speculate a bit that, again, in this younger age range, folks still view themselves as being fairly invincible. And, oh, if I get it, you know, I'll be able to brush it off and move on. And I've heard one of our physician colleagues, Dr. Powell, say that when the younger folks are coming to us, they waited too long. And they tend to be sicker than they would have been if they had come to us on the front end when they first saw symptoms, and or had gotten the vaccine when it became available. So I think we have a lot of those dynamics going on. So to your question of what can you do, Mr. Watson? So first of all, take in information like this that we've attempted to share and process it for yourself, and really begin to figure out for yourself what's fact and what's fiction as you understand it. You know, it's true that, you know, we have to kind of think about this for ourselves, because we then get to go out and influence the people that we live with, our friends, our family members. They're going to take their cues from us. So if we're saying, you know what, I did some research, I listened, I'm going to take that vaccine, that's one thing. But if we're still skeptical and on the fence, then that's going to come across to people. The last time we did a community WebEx like this, there was a man on there, African-American male, who said, you know what, I was kind of on the fence, but he said, I've got an appointment in a couple of days, and my college-age son was going to follow my lead. Had I not said I was going to get the vaccine, he wasn't going to get the vaccine. But because he said he was going, the son came along as well. So that's the power of influence in the circles that we all walk in. So I think the questions tonight have been great. And I do think, to your question, what we can do is we have to tell the story. If you believe the vaccine is safe, first go and get the vaccine if you haven't already, and then take somebody else along with you, and be very honest about how you're reacting and encourage people to take the vaccine.
Thank you for that. Fully vaccinated.
Go ahead, Pastor Montgomery.
Yeah, that was a great question. Really helpful. And I want to, I'm not picking on you, Miss Cook. I want to share a story that I shared before we had this webinar tonight. My wife told me over the weekend that a childhood friend of hers refused the vaccine, and that she got COVID, and she reported that it was the worst 3 weeks of her life, being sick from COVID-19. And I asked the question, did she get the vaccine? And she said, oh yeah, she got the vaccine after the fact. So it is important to get the vaccine, again, to avoid having a repeat of you know, a life-threatening illness. And we know it's killed in the United States almost 600,000 people now, which is really just mind-boggling, really mind-boggling.
I was basically asymptomatic when I had it. I probably wouldn't have known I had it. I very, very mild.
Yeah, and so again, when you think about the fact, again, I use this term inoculum. What was your dose? So either you had a super good immune system, or you had a very mild inoculum, a very mild dose of COVID-19, and therefore you had a very mild course. And so your body might not generate significant antibodies. Significant. You have some, but they might not be significant enough to protect you from another bout or another exposure. So a vaccine probably would. Almost, you know, again, 94%, 95%, or 72% chance of that happening.
And I think Pastor Montgomery has a question.
Yeah, well, first, thank you all for your time, your diligence, this amazing conversation. Last thing I throw out there to you all, as we think about vaccinations in general, and as you stated in your presentation, vaccinations are not new. If you were to compare and contrast the desire and request for folks to get the COVID-19 vaccination to how we would normally ask folks to get the flu shot, how much different are we talking about here?
Either of you have these numbers. I don't know what percentage of people get vaccinated for the flu. What I can tell you is that, what I can tell you in healthcare, in hospitals, we mandate it. So right now at Cone Health, if you work there, you're going to get the vaccine for influenza, 100%, or you're not going to, unless you have a medical reason. So let's say it's 90% of the people get the flu shot. With COVID right now, I think we're hitting somewhere in the low 60% percentile. And that's with a lot of encouragement, and that's with a pandemic. Somehow I think somewhere, I don't really want to, I hate to quote something that's not correct, but somewhere, I'm thinking general public somewhere around 30% for flu. I don't think it's very good, but I don't know that number exactly.
Yeah. And I just asked that question out there as I know, one, I'm in that younger age bracket that folks are a little bit more skeptical, but I'm fully vaccinated and encourage others. And my comment is that same way you go to a doctor every year in flu season, your doctor's going to ask you, have you had the flu shot? Encourage you to get the flu shot. We do the same kind of actions around doing free clinics for folks to get flu shots if they can't afford it or don't have health insurance. And so for my sharing with folks of encouragement, it's in a sense of we've been doing this encouragement in years past. We're just talking about a much deadlier disease, and that's why we have this larger encouragement for folks to be vaccinated at this level.
I will share my personal story as we close out. So, I work in healthcare. You would think that I would have been like Dr. Powell and raising my arm the first day the vaccine was available to me. Well, that wasn't my story. First of all, I don't like needles. So Dr. Powell is right. A condition of employment here is that I have to get a flu shot, and it's a process for me to get my mind right to go and get that flu shot. But I do it every year because I like the paycheck that comes, right? Right, that comes every 2 weeks. It keeps the lights on and all that. That's a nice thing. So when this vaccine became available, I was like, okay, I'm just going to wait. I don't want to be in that first group. I'm just going to wait and see what happens. Well, you know what? I'm married. My mother, who is elderly, lives with us. My mother-in-law, who is elderly, lives with us. And I quickly realized that my cavalier attitude might bring a virus and worst case scenario, death to my wife and to my mother and my mother-in-law, because I was going to hang out there on the fringes and wait for a few more people to be vaccinated so I could see what happened. Well, fortunately, I came to myself pretty quickly. And so I got the vaccine and never looked back. So I am fully vaccinated. My wife's fully vaccinated. Both moms are fully vaccinated. My mother's 91, my mother-in-law's 96. They are both vaccinated and have had, no concerns from being vaccinated. So that to me was a real wake-up call that I need to put myself aside and really do what was best for the people that I live with, the people that I love, and the people that I'm going to come in contact with. So again, for people who are hanging out there on the fringes, I just encourage you to think about, yes, taking the vaccine because it works for you, and also consider the people that you're going to come in contact with that you know and that you may not know. So that's my story, and that's what motivated me to get the vaccine.
We had one last question come in through the Q&A. What are your thoughts as to why medical employees would not be receiving the vaccine? Do you think it's just a problem of not leading by example?
Again, I think it's a bit all over the board, and I think that So for us, medical employees is everybody from, medical doctor, Dr. Powell, to the folks who, do great work in cleaning our rooms and cooking the food and everything else in between. And I think they're just varying levels of, again, trust and understanding, even with people who work in the healthcare system. So we've not looked at the data to be able to understand where folks are who haven't had the vaccine in terms of, kind of what they do in their backgrounds. But that's still a number that we've got to work through and break through, not just here at Cone Health. It's true across healthcare systems in the US. We are not the outlier here. Sadly, every healthcare system is battling with that. I just think people are trying to figure out, does this work for me or does it not work for me? And that's why we're having conversations like this. The very conversations we're having with the community, we continue to have with our own team members to get them into a good place so we can answer their questions and allay their fears about the vaccine.
So we are right at the hour. Mr. Watson or Pastor Montgomery, would you like to close us out?
Well, I will say, first of all, thank you, Dr. Wallington and Dr. Powell and Jill for setting this up and spending your time with us this afternoon. It's much appreciated, and we will make sure that we do all we can to get this word out and share this presentation with our congregation as soon as possible. And once again, thank you guys so much for the time that you spent with us this afternoon. And I'll turn it over to Pastor if he's got anything he wants to add.
Just ditto. Again, we thank you. Someone who knows that the more we talk about this, the more we normalize these conversations and help. It is an effort. And if it means one or two more people get a shot, that's better for them, their family, and their household. And so we appreciate you all taking the time out of your stay to come and be with us. And again, appreciate it for you being here with us tonight.
All right. Well, thanks very much for having us. And with that, we're going to end things. Everybody have a great night.
You too. Bye-bye.
Bye-bye.
Thank you.
Good night.